Hi friends, this is Rachel, the dental hygienist. I hope you're doing well. I'm here today to kind of speak to those that usually have a challenge going into the dentist office, especially if you have any anxiety. So this is just a couple of things that I have out to show you about what we use in the dental office, and specifically when you're a traveling dental hygienist like myself. I'm able to see patients in their homes, and I love it. That's the best job, and I really get to help people that normally can't go to the dentist office, and they get the care that they need. So I wanted to just kind of show you some of the things that we have, and we'll start off with the thing that you're probably more familiar with is the blood pressure machine. We like to check blood pressure to make sure that your blood pressure isn't too high. So with this one, it's an automated machine, and so it does get a little tight around the arm. Okay, this one is takes about 1 minute for it to get, and then it gives us a number, and we're looking for somewhere around 110 to 120 for a healthy range on the top number, and then the bottom number we want to have somewhere between 60, around that range. So preferably not higher than 70 if we can do it around that range. So 55 to 65 is usually pretty good. So that's something that we like to take before any visit. And then some of the other things that we have here are, before I get to these scary looking things, I'm going to be pulling out all of my goodies here. So this essentially is all the things that we use in a cleaning visit. So I have some gauze here, floss, I've got some polishing paste. You may see some different flavors in there. So there's flavors like, for the paste, we've got, I think we have a chocolate. There was strawberry. I'm not sure if strawberry is still in there. That one's pretty popular. And we also have marshmallow. That seems to be a favorite as well. Nice and mellow. And then on top here, we've got some fluoride varnish, and the one with the blue on it, that one is a blue raspberry. That one is a favorite. Everyone's loving that one lately. And then of course we have some gauze right here, so it's nice and soft. Okay. And then we have this that we use just to help protect my patients. Each patient, we put a little barrier on here on the polisher paste. And then I have some floss that we use. Okay. And then these little brushes over here, this is to put the fluoride on to help prevent cavities. Okay. And then of course we have our little polishing tip here. Okay. So each one is individually packaged. So I'll usually take it out and I'll leave it over here on my tray setup for my patients. That way we're not cross-contaminating things. And then from there, I'll show you the polisher, since we're on the trail of polishing and the flavors. So the polisher, it has a little button on it, and it just polishes your teeth. So it goes right on your teeth surfaces. It's kind of like a tickly feeling, so it doesn't hurt at all. I can put it even on the highest setting. Doesn't hurt at all. Just goes right on your teeth. And it just helps to get all of the bacteria off, so all the bad stuff off of your teeth. And we do that everywhere, on every tooth, so it does take a little bit of time to make sure we clean off everything good. When we're all done with that, we go ahead and rinse. So this looks a little bit scary, but this is just water in here. And all we're doing is pulling it up, and then I'm going to be putting it in the mouth. So it looks like a syringe, but it's not. It's not like a syringe that's going to go into your mouth and into the tissue. So this one has a little tip at the end that we use just to go around the mouth and just to kind of flush out. And so we just push down on that, and then we get water in there. Okay. This is my suction machine, so I just turn it on. Makes a little bit of noise, nothing too bad. And then we have a nice comfort suction here. So it's comfortable. It doesn't snag on any tissue. It's very comfortable. Okay. And then all we do is just suction up the water that way. So we'll pretend like this water, this cup of water here is your mouth. So your mouth has got water in it. We want to clean it out. So we just suction it up. Okay. Pretty easy. And then no more water. Oh, little drip, but otherwise no more water. And then this little section that I use over here, I go ahead and change this out between every patient. So the whole entire thing comes off after I finish flushing the line with a special enzyme solution. I go ahead and flush all this out. I wipe it down, and then I sterilize this. So this whole entire thing, minus the suction tube, this gets thrown away. Okay, we don't reuse those. And this whole entire thing just pops right off. Okay, pops right off, and then I put it right into a bag and into my ultrasonic unit, clean it out. And then I rinse it off really well, and then I put it into a bag and it gets sterilized in an autoclave. So that ensures that all the bacteria, everything is completely clean between each patient. Okay, and with this one, I keep a little barrier over here so that way it doesn't get into all the little nooks and crannies. And then when I'm done with this machine, I will empty out all the water that gets in here, usually like saliva, blood, like you don't want to have all that stuff in there. So I'll clean it out with the enzyme cleaner a few times, and then I'll go ahead and wipe on the inside, clean it out. The whole entire area up here gets cleaned, the button, everywhere, everything gets clean. Okay, and now time for the scary looking instruments. So this one over here is a mirror. This one I just use to retract the tissue of patients, and then of course it's a mirror, so it's going to see everything that I need to see that I normally can't see. And of course I use the gauze so I can kind of clean off a little bit better and see better on the teeth. I like to keep everything in this little cassette here. It's easier to transport with. I don't have to worry about poking myself. I don't have to worry about any of the instruments getting poked out through the bags, which is a typical problem in the dental office. We use bags a lot, and there's always something poking through. And every time it pokes through, I have to re-sterilize it all over again. So this ensures that I don't have that issue. And then the next thing that we have is a probe. So this one, it takes measurements of the gums. So it's going to measure between the tooth and the gum. And this, we want to have a good number of 1 to 3 millimeters. Okay, so with this one, sometimes it can feel a little bit pokey, but we try to be as gentle as we can whenever we're using it. And sometimes if you feel any discomfort, we can put some little gel on there to make sure that you're comfortable. This one goes right on the tooth surface, and it checks to see if there's any cavities anywhere. Okay, so kind of like if you were to put it like on your nail, you're not going to feel anything. No pain at all, nothing whatsoever. So with this one, it's just pretty much counting the teeth, seeing what teeth are there, and then checking for any spots that are sticky is what we're looking for. Okay. Then from there, we have a few scalers. So this one is for the very back teeth. This is just to kind of scale off the bacteria that's in the back. So we use it from one side and then the other side. This one has 2 sides to it. Same thing with this one. This is for the very back teeth. We're making sure that we're getting those very back areas nice and clean. This goes in between the teeth really nicely. And this one over here I use also for the back. This particular one is really great for the very, very back teeth. and mainly used for the front surfaces of the teeth. Okay. So this one works fantastic, and I use that one all the time. This is a little teeny tiny one. I don't even know if you can see that. It's so small. This is to get the little teeny tiny pieces that are on the teeth. Kind of get off all those little pieces of calculus and stain that are right in between when it's hard to reach. And then this one is going to be the one that we use for the front teeth. So this is called an anterior sickle scaler. So this one we use to get those front surfaces. So all of these, it's kind of like if you were to scratch your nail. You're not really gonna be hurt. So it's not really gonna hurt you too much. So don't want you to be scared or nervous about getting any dental work done or dental cleanings, because we do the best we can to make sure that you're comfortable. Okay. And if you have any questions, you can leave them for me in the comments. And I hope that you get to see your dental provider soon, because clean teeth are very important for your overall health. And so it's something that we want to make sure that we're taking good care of our teeth, that we're brushing and flossing every day. And I hope to see you soon.